let's talk about early stage communication changes in dementia in general. Again, symptoms vary depending on the cause or type and depending on the person. So first of all, we may see word finding difficulty, and this may be associated with memory changes or language changes, or both, depending on the underlying cause. So speaking more slowly, more pauses, hesitating, this can be the result of trouble finding words or planning out those movements for speech. So in this example here, a woman living with early onset dementia struggles to find the word guitar while speaking with her friend. And early communication symptoms may also be related to other cognitive changes. For example, changes in reasoning, attention, and recognition, leading to difficulty following conversations and understanding situations. In this example, a doctor has just reviewed a ton of information with a woman who has dementia, and when he asks if she understood him, she's overwhelmed by the information. And maybe this is information that she's very capable of understanding, but it just wasn't presented in the best way for her. In early stages, changes in short-term memory and comprehension can also impact communication. These short-term memory changes can look like repeating words and concepts, forgetting the topic of conversation, forgetting information like a name that was just shared, or forgetting part of a set of directions. But what's important to note is we also can't remember something if we never understood it in the first place, or if we weren't able to sort of pull out which parts of information were important. So you can think about it like this. If you've lost track of the context of the situation, for example, and what a person is saying to you, therefore, doesn't really make a lot of sense, it's a lot less likely for that information to then stick in your brain in a way that's accessible. And for someone living with dementia, as well as for plenty of people who aren't living with dementia, it can take more time to process information. So if we're throwing a lot of information at someone really quickly, they're less likely to comprehend it, and then remembering it isn't really even on the table. Depending on age at time of diagnosis, other age-related changes may also impact communication, and specifically comprehension. And this includes normal age-related changes in vision and hearing. Yearly hearing screenings are recommended for those who are 60 plus, for those with exposure to loud noise, and also for those who have a history of hearing loss. And it's really important to do this because hearing loss can exacerbate cognitive changes. Early communication changes may also be related to speech and voice. For example, in the case of Lewy body dementia. Speech may sound quiet and monotone, sounds may be imprecise. Hypokinetic dysarthria is the term that we use to describe these changes. Hypokinetic refers to smaller movements, and dysarthria is the term we use when referring to speech changes that result from muscle impairments. Basically, this can sound like really quick, quiet speech or some variation of that. Right. So moving along, as a result of other early brain changes in Lewy body dementia, a person might not be aware that their voice is quiet. They might perceive that it sounds normal, and this can look like denial or stubbornness, but it's a result of actual brain changes that alter their perception. So it might feel like they're speaking loudly, and they may feel like you're asking them to shout. Apathy or decreased motivation can also impact communication in different types of dementia. So we might see changes in pitch, like talking with a really flat affect, sort of like this, meaning it's speech that's really lacking emotion and intonation. And this can make someone seem apathetic even if they aren't really feeling that way. In early stages, attempts to initiate conversation may decrease. And this may be related to apathy and overall decreased initiation, but can also be connected to fatigue or frustration. If someone feels like they aren't being heard, they may end up feeling like they're going to just shut down. In the behavioral variant of frontotemporal dementia, early changes that impact communication may specifically include disinhibition, meaning less impulse control, apathy, less empathy or concern for others, and someone may also struggle to understand tone of voice. So maybe even mistaking like a sunny, positive tone for an angry or aggressive one, for example. I do also want to make a note about changes in awareness that can impact communication even in those early stages. Anosognosia, a term that refers to lack of awareness or recognition of one's own condition, is common across types of dementia, but there are people living with dementia who retain awareness of their condition for a while. In fact, I know plenty of people living with mild cognitive impairment, early stage dementia, who are very aware of their condition and who are learning to adapt and continuing to enjoy life. But all of this, of course, varies depending on the person. Now that we've gone over some possible early stage communication changes, let's focus on strategies. The first one I want to talk about is adapting the environment. And this is going to be a really useful strategy throughout the stages of dementia. So from misinterpreting certain sounds to trouble paying attention in the presence of background noise, difficulty processing sounds and language can impact someone's ability to focus on a conversation or even a simple request. We want to decrease distracting sounds and visual clutter in the environment when possible. And this means on the most basic level, turning off the TV before a conversation or closing a door to decrease outside sounds. And ensure that hearing aids, glasses, any other important gear are in place in order to set the person up for success with comprehension and communication. And that goes for conversation partners as well. Another strategy is to be sure you are face-to-face for optimal communication. This way, you read each other's expressions and body language. And sometimes when we're rushing around and trying to do a million things at once, we do forget to speak face-to-face, and we forget to grab someone's attention by stating their name. So ask how they're doing, introduce yourself if needed, build a nice rapport in that moment, and then we can continue from there. Knowing that comprehension changes impact interactions with someone living with dementia, it is helpful to keep in mind that a person may need additional time to process information. So as a conversation partner, consider pausing between thoughts. Rushing through an interaction will actually make the conversation take longer and may result in more frustration. Additional time is a key accommodation. Pauses are okay, and we don't need to fill in moments of silence unless that's requested. Taking comprehension changes into consideration, we do also want to allow extra time to process directions and break down complex directions into simple steps. You can consider providing this information both verbally and non-verbally. In the example I have here, a young woman turns to her mom and says, "Let's take a look at the next step in the recipe." She pauses for processing, and then she asks, "Can you read step 6 to me?" We can also provide reminders of the topic of conversation in a natural way, and props help a lot here. So this way you aren't saying, "Hey, remember what we're talking about?" You're just commenting on something that's present. So in this example, a man says to his sister, "I love talking to you about mystery novels," cueing her into the topic of conversation. And they're also holding their books, which helps too. I do also like to mention it is important to avoid, as much as we can, asking someone if they remember something. Quizzing, as we call that, causes a lot of anxiety, and it can be really frustrating for the person. You might be asking them to do something that they aren't able to do because of brain changes. In early stages, another helpful strategy can be to just encourage the use of compensatory strategies to remember information that's been communicated and to improve ease of communication. For example, writing new information and thoughts down in a designated notebook, repeating information out loud, and also setting alarms with clear labels. And these are things that can help anyone. If there's a breakdown in communication leading to the person missing important appointments, it can also be helpful to assist the person in using a planner and notebook system that works for them to keep track of scheduling, any information that's been communicated, and things that matter to them. And this may take a fair amount of trial and error. Occupational therapists, and speech pathologists can be very helpful here. And we do also want to be sure to avoid having information on multiple lists. People sometimes have lists and Post-its tacked up all over the place, but we do want to try to condense to one notebook or page or use a whiteboard. Accommodations should not be overwhelming. And we want to encourage participation in activities that involve communication with accommodations only as needed. So avoid talking for the person or doing things that they can do themselves with accommodations. Now, when it comes to strategies for specifically difficulties finding words, I want to sort of walk you through something a speech language pathologist can help to do. So basically, together with the person living with dementia, we can create a list of topics and activities that are important to them, things that are meaningful. And the person with dementia should be as involved as possible in choosing what matters most for them. And this will work best for someone who does have awareness of their language changes, but it can be adapted. So once we have that list, if a person is having trouble communicating about certain things related to one of their favorite activities or routines, for each topic or activity, we can then create a vocabulary list of relevant words to practice, and we can use different methods to enhance the person's ability to find those words more easily. Using images may help. Some people like taking photos and organizing them with words on the page. We can review the words and pictures together, talk about concepts related to the words, and role play activities and conversations using the list or the pictures for support. We may also consider writing a script together for a given scenario and then rehearsing that script. Again, this isn't going to be appropriate for everyone. It's most helpful for someone who's having trouble and specifically wants to work on strategies that can help. And there really may be people who do fit that description, but others who aren't aware of their impairments might not want to participate in something specifically like this. I do want to add that these lists and scripts can also be used to develop augmentative and alternative communication systems, or AAC systems, together with a speech pathologist. And these devices, again, not appropriate for everyone, but they can be used to supplement speaking as the disease progresses. And there are both low and high tech options that can be discussed. So lists, AAC devices, rehearsing scripts, these can help in any scenario that involves communication. So even like asking questions at the doctor, grabbing drinks with friends, poker games, all kinds of things. So I am biased, but I do definitely recommend a referral to a speech language pathologist early on, even if it feels like there aren't significant issues with communication going on yet. Strategies do work better when they're learned before they're needed. We can offer evidence-based interventions to help the person maintain communication abilities and quality of life for as long as possible.